Hi everyone, it's Sarah from International Rejuvenation, and today I'm going to give you 8 steps you should follow when considering overseas surgery. Step 1. Always make sure that your local GP is supportive. What I mean is, often when patients get back from surgery, even though they've had the final okay from their surgeon, they still want to come back and see the local GP, and the last thing you want to do is come back, go see your local GP and find out that he isn't supportive at all and starts putting negative thoughts in your head. And so if you find out before you go, of course you can try and find somebody else who is supportive of you going overseas for surgery. Step 2. Always make sure that the hospital you're considering has JCI accreditation, which means Joint Commission International. Simply, if the hospital doesn't have JCI accreditation, don't go. It's as simple as that. Step 3. Always use a medical tourism professional. The reason I say that is we have done a lot of research and put a lot of hours into finding a hospital that we like, and of course surgeons that we will recommend to our clients. We know which surgeons have specialty in different treatments, and we can, when you call us, we can then of course recommend a surgeon from what he specialises in. Step 4, always make sure that you have a list of questions for your surgeon at time of consultation. And the reason I say this is, if you have a list of questions, you won't forget them. I know I personally, when you go into the doctors, you're just kind of excited and you think, oh, I'll remember all my questions, but you don't. You're just in the moment and listen to your surgeon. Once you come out of your consult, you then go, oh, I forgot to ask questions. And there's nothing worse than that prior to surgery. So always take a list, even a couple months out or prior to your surgery, start writing a list and make sure you don't forget them on the day of your consultation. Step 5, if you use a medical tourism facilitator or professional, you have the opportunity to speak to past patients. That way you can speak to someone that's had the same procedure as you or has had your surgeon, and that way you're speaking to someone that's been through the same process as you and can give their honest opinion about everything. Step 6, always find out how long you need to be overseas for your procedure before putting in for leave or for holidays with work. The reason I say this is the last thing you want to do is get 7 days off work and then find out partway through the process that you actually need 10 days. The surgeon, of course, will not be happy to find out that you're planning on leaving early, as this will affect your recovery and compromise the results of your surgery. Step 7. We always recommend you get a direct flight for 2 reasons. It lessens the chance of DVT, and secondly, I personally find that when you've been overseas for a period of time, it's been quite emotional, and the last thing you want to do is be stopping off God knows where for 4 to 6 hours and then getting on another flight and then coming back. The last thing you want to do is that, so always make sure you get direct flights to and from the country you're having surgery in. Step 8 is once again touching back on step 1, which is family GP or local GP. Of course, if you've found a good GP before you've gone, a lot of patients, even though they've had the final okay from the surgeon prior to flying home, a week or so after they've been home, they like to go and see their local GP just to give them the once over and make sure that everything has gone well. So that's of course why in step 1 we want you to find a supportive GP before you go. Okay, and I just want to say thank you for watching. If you have any more questions, please call us on 1300 140 040 or email us. Thank you. Bye.